Okay, let's dive in. We're digging into some really focused source material today.
Yeah, it's all about vascular health viewed through the lens of nursing. Specifically, a foreword from a core curriculum book.
Right, an expert take from the get-go. And it opens with, well, quite a profound thought.
From Sir William Osler, often called, a father of modern medicine.
And he talks about variability being the law of life.
Exactly. Paraphrasing a bit, but no two faces are the same, no two bodies are, and people react differently to diseases, too.
That really sets the stage nicely, doesn't it?
It does. It tells us straight away that complex conditions aren't monolithic. Everyone's experience is different.
So our mission here is to pull out the essentials on vascular disease from this source, keeping that variability in mind.
Let's do it. So first off, what is vascular disease according to this text?
Good question.
Well, it clearly defines it as disorders of the circulatory system. So arteries, veins, the lymphatic system.
Okay, the body's plumbing network.
Right. And this is a crucial point, it specifically excludes the heart itself.
Ah, interesting. So not the pump, just the pipes.
Pretty much the vast network around the heart.
Okay, and the source gives a key example, doesn't it? Peripheral arterial disease, PA.
Yes, PAD comes up quickly. And there's a statistic that really grabs your attention.
Let's hear it.
Based on data they cite from 2013, PID affects roughly 8.5 million adults aged 40 or older, just in the U.S.
Wow, 8.5 million. That's a lot of people.
It is. But the source stresses that the real significance isn't just the number, or even, say, the leg pain PAD can cause.
Okay, so what's the deeper insight?
The key thing is that PAD is often a signpost for systemic atherosclerosis.
Right, atherosclerosis, that's the plaque buildup, hardening of the arteries.
Exactly. So when a doctor sees PAD in the legs, this source says it's often a warning sign that this process might be happening throughout the body's arteries.
So it's not just a localized leg issue then?
Not at all. Because it signals that wider artery trouble, the source emphasizes it brings a high risk of really serious events. We're talking stroke, myocardial infarction, which is a heart attack, and ultimately a higher risk of cardiovascular death.
So PAD is like an early warning system for your brain and heart too, potentially.
You could certainly see it that way, yeah. Which leads directly to the source's next big point.
Which must be about catching it early.
Precisely. The importance of early recognition of any signs, even subtle ones, of vascular disease.
Makes sense. And what's the payoff if we do that?
According to this foreword, combining that early recognition with guideline-directed medical therapy.
So the standard proven treatments.
Right. It means patients get identified sooner, their quality of life generally improves, and they get better, more consistent care over time.
So this core curriculum, by laying out this knowledge, it's really about empowering nurses, isn't it? Giving them the tools to spot these things.
Absolutely. They're often on the front lines. The foreword hints at the scope covering, assessment, diagnosis, research, specific therapies.
And it covers a whole range of conditions, not just PAD.
Oh, yeah. Things across that whole vascular network. Carotid artery stenosis, the neck arteries.
Affecting blood flow to the brain. Scary.
Aortic aneurysm, that's a weakness in the main artery. Other vein problems, lymphedema, which involves swelling.
So it's comprehensive.
It aims to be. And it all loops back to that Osler quote,
And the variability.
Yeah. Understanding this broad range helps nurses appreciate and, well, effectively manage how differently these conditions actually show up in real people.
Okay, so let's wrap this up. The core idea from this source seems to be vascular disease affects the wider circulatory network, not the heart directly.
Correct. Arteries, veins, lymphatics.
And conditions like PAD can be common, maybe even silent initially. But they're serious indicators because of that link to systemic problems.
Exactly. That link to atherosclerosis, stroke risk, heart attack risk.
Yeah.
It makes early understanding and care really critical.
Right. So thinking about Osler's variability idea again, if disease really does manifest so differently in each of us, especially for conditions that might not have obvious early symptoms, it leaves you with a thought, doesn't it? A question for you, the listener, to maybe ponder.
Go on.
If we truly embrace this individual variability, how might that change our approach to things like, say, routine health screenings, or maybe how personalized treatments could get down the line, particularly for these vascular issues?
Yeah, that's a really interesting question to think about. How different could healthcare look if we fully accounted for that uniqueness?